Picture this. Stepping into a sandblasting booth
Huh?
where you can almost taste the airborne grit.
Mm.
Or imagine the controlled chaos of a commercial kitchen during a rush. A ballet of sharp knives and sizzling oil.
Yeah, intense environments.
Even something we barely give a second thought to, like getting rid of an old car battery, can have hidden hazards.
Mm.
Let's dive into why. Because today on the Deep Dive, we're tackling a fascinating collection of materials all about workplace safety.
Mm.
We're looking at everything from real exam scenarios to on-the-ground risks in mining, agriculture, and well beyond.
What's immediately apparent when you look at this material is the sheer variety of potential dangers, dangers that can be present in places we might not instinctively consider risky.
Exactly. So if you've ever felt a bit lost in the world of safety regulations or just wanted to get a clearer handle on the real risks in different jobs, this is for you.
Right.
We're on a mission to pull out the most important information, those crucial insights, to give you a better understanding of the hazards out there and, crucially, how they're handled.
It makes you wonder, doesn't it, with such a broad spectrum of risks, what are the fundamental principles that sort of underpin workplace safety?
Well, we've got a really interesting set of sources to explore today. We'll be looking at excerpts from EBA Hazards, which details different kinds of respiratory protection,
Okay.
and looks closely at case studies on silica exposure and the surprising risks of car battery disposal.
Right.
We also have a breakdown of hazards in a bakery and commercial kitchen, a surprisingly complex environment, and some visuals of workplaces like car body repair, welding, foundries, and even aircraft refueling.
So quite visual then.
Yeah, each highlighting its own set of challenges. Then we're heading out to farms with a detailed look at agricultural hazards, from Q fever to avian influenza.
Agriculture, yeah, that's a big one.
We'll also be navigating the regulations for confined spaces in NSW. And finally, we'll be tackling some practical questions around health surveillance, noise monitoring, respiratory testing, and even a chemical exposure emergency.
Wow, okay. So if we look at the bigger picture, what becomes clear is that effective workplace safety isn't just about reacting to accidents, is it?
No, not at all.
It's about proactively identifying a whole range of potential exposures and putting robust systems in place to minimize harm,
Our aim is precisely that. To extract the key insights from this diverse information, make it clear and understandable, and really highlight what it means for keeping people safe at work and for your understanding of how that works.
Okay.
So where should we begin? Respiratory protection seems like a really fundamental area, especially with that silica case study.
It's certainly a cornerstone of workplace safety, yeah. That table outlining respiratory protection devices gives us a good starting point. What are your initial thoughts on the different options presented there?
Well, it immediately strikes me that choosing the right protection isn't just about grabbing the first mask you see,
Definitely not.
You've got the basic disposable dust masks, which are handy for some dust, but they're not going to cut it for everything, especially if you need a tight seal or protection from fumes or low oxygen.
Right. Very limited application, really.
Then you move up to half-mask respirators, which you can reuse and fit with different filters, but they leave your face and eyes exposed.
Mm-hmm. A key limitation there.
And then the full-face respirators offer that extra protection, but they can be heavier and, well, less comfortable for long periods.
Exactly. Each type is designed for specific hazards and has inherent limitations. The PPR, or powered air purifying respirator, is interesting because it can be more comfortable for extended use.
Right, the fan help.
By reducing breathing resistance, and some offer full face coverage, but then you have the added considerations of battery life and maintenance. Chemical cartridge respirators are very targeted, which is great if you know exactly what you're dealing with, but not so helpful if the hazards are unknown or if there's an oxygen deficiency.
Right, you need the right cartridge.
And finally, SCBA and SAR self-contained breathing apparatus and supplied air respirators provide the highest levels of protection, even in oxygen-poor environments, but they come with their own complexities in terms of training, bulk, and cost.
So a big investment.
Ultimately, the selection needs to be driven by a thorough risk assessment of the specific hazards present. You can't just guess.
Okay, so keeping that in mind, let's look at the case of the 25-year-old sandblaster exposed to crystalline silica. What are the primary health concerns that jump out?
The health effects of silica exposure are significant and can be long-lasting, really serious. The main concern is silicosis, a progressive and irreversible scarring of the lungs.
Irreversible, right?
Which in turn increases the risk of other respiratory diseases like COPD and even lung cancer. But the impact can extend beyond the lungs.
Mm.
Silica exposure has also been linked to cardiovascular issues like pulmonary hypertension, autoimmune diseases such as scleroderma and rheumatoid arthritis, as well as kidney disease. It highlights how a seemingly localized exposure can have far-reaching effects on the body.
Wow, that's a stark reminder of the systemic nature of some workplace hazards. So how do you go about measuring what this worker might have been exposed to?
Assessing environmental exposure to silica involves several key techniques. Personal air sampling pumps fitted with cyclones to separate respirable particles, those tiny ones that get deep in the lungs,
Right.
are attached to the worker to collect samples from their breathing zone over a period. Passive silica badges can offer a broader indication of exposure levels, though they're, less precise for detailed assessments.
Okay.
And real-time silica dust monitors can provide immediate readings in a specific area, which is useful for identifying high-risk tasks or evaluating the effectiveness of control measures.
Like checking if the ventilation is working properly.
Exactly. All of this is then compared to the Safe Work Australia exposure standard of 0.05 milligrams per cubic meter.
Right, that's the legal limit. And in that context, we see terms like TWA, STEL, and carcinogen. Can you clarify what those mean in practice?
Certainly. TWA, or time-weighted average, is essentially the average concentration of a hazardous substance in the air that a worker can be exposed to over a standard 8-hour workday and a 40-hour workweek without expecting adverse health effects.
Okay, the average over a shift.
Yeah, exposure standards are often expressed as TWAs. STEL, or short-term exposure limit, is the maximum concentration a worker can be exposed to for a brief period, usually 15 minutes, without experiencing issues like irritation, provided the overall TWA is not exceeded.
So for short bursts of higher exposure.
Correct. And carcinogen, in this context, simply means that crystalline silica is classified as a substance known to have the potential to cause cancer in humans, which is obviously very serious.
That really puts the exposure standard into a clearer context. Now, looking at the worker's spirometry results, we see reduced FEV1 and FEC and a reduced FE1-FEC ratio, leading to a diagnosis of a mixed spiral pattern. What does this tell us about his lung function?
Spirometry measures the volume of air a person can forcefully exhale in 1 second, that's FEV1, and the total volume of air they can exhale after a deep breath, FVC.
Okay.
The ratio of these two, FEV1, FVC, is a key indicator of airflow obstruction. In this case, the fact that both FEV1 and FVC are reduced suggests a limitation in the amount of air he can move.
Like smaller lungs almost.
Sort of a reduced capacity. While the reduced ratio points towards difficulty in exhaling quickly, a mixed pattern indicates the presence of both obstructive and restrictive elements.
So a bit of both problems.
Think of it like having both a narrowed airway making it hard to blow out quickly, that's obstruction, and a reduced lung capacity overall, that's restriction. This is a concerning finding in someone with potential silica exposure.
Right. So given this work environment and these lung function results, how suitable are the different types of respiratory protection we discussed earlier?
Well, as the case study rightly points out, a basic disposable dust mask simply won't provide adequate protection in a sandblasting operation with significant silica exposure. It's just not enough.
Not nearly enough.
While it might filter out some larger particles, it's not effective against the fine respirable silica dust that causes the most damage deep in the lungs. A cartridge respirator with P100 filters would offer a higher level of protection against particulate matter and might be considered adequate for lower levels or shorter durations of exposure in an oxygen-normal environment.
But maybe not ideal for sandblasting all day.
Exactly. It's not the ideal solution for prolonged high-level exposure. The most appropriate choice here is a supplied air respirator, potentially a PPR version, which provides a clean source of breathable air independent of the contaminated workplace atmosphere.
That makes sense. Ideally, you want to control the hazard at its source, right?
Absolutely.
But when that's not fully possible, the right respiratory protection is critical. So what key advice would you give to both the management and the worker in this situation?
Okay. For management, the focus needs to be on implementing the hierarchy of controls. Always.
The hierarchy, right. Eliminate first.
Yes. The most effective measures are eliminating the hazard where possible or substituting it with a safer alternative. In this case, that might involve exploring alternative blasting materials.
Like not using silica sand.
Precisely. If that's not feasible, engineering controls are crucial. All sandblasting should occur in a well-designed and maintained enclosure with effective ventilation and dust collection systems, including local exhaust ventilation right at the source of dust generation.
Sucking the dust away immediately.
Yes. Wet blasting techniques should be used wherever possible to suppress dust. As a lower-level control, but absolutely mandatory here, is the provision and enforcement of external air-supplied respiratory protection.
Making sure people actually use it.
And use it correctly. Regular metal surveillance, including high-resolution CT scans of the chest every 2 years and annual spirometry, is essential for early detection of any lung changes.
Catching problems early.
And finally, comprehensive training on the hazards of silica exposure, the proper use and maintenance of all PPE and safe work procedures is vital.
Okay, and for the worker?
For the worker, the advice would be to strictly adhere to all safety protocols, use the provided respiratory protection correctly and consistently for every single blasting task, attend all scheduled medical surveillance appointments, and importantly, report any respiratory symptoms or concerns to management immediately. Don't ignore a cough.
That's a really comprehensive look at a serious respiratory hazard. Now let's shift our focus and look at some other work environments where the hazards might be, well, less obvious. That table for a bakery and commercial kitchen really highlights the diverse risks you can encounter in a seemingly everyday setting.
Absolutely. What's surprising about a bakery and commercial kitchen is the combination of chemical, physical, ergonomic, biological, and even psychosocial risks that are present.
It's a real mix.
You have chemical exposures from cleaning products and potential inhalation of flour dust, which can lead to respiratory problems like baker's asthma. Physical hazards include burns from ovens and hot surfaces, cuts from knives and equipment, slips and trips on wet floors, noise from machinery, and electrical hazards. Ergonomic risks are significant due to repetitive tasks like mixing and lifting heavy sacks.
Lots of bending and twisting.
Definitely. Biological hazards relate to food safety and potential foodborne illnesses. And the high-pressure, fast-paced nature of the work can contribute to psychosocial stress. It underscores that workplace safety is about more than just preventing, dramatic accidents.
And then we have these images, a car body repair shop with someone painting a car.
Yep. See the spray booth?
A welder joining metal, a foundry pouring molten metal, and aircraft refueling. These visuals really drive home the sheer variety of work environments and the different kinds of hazards that come with each. You see that painter in the spray booth, and immediately inhalation of paint fumes comes to mind.
Solvents, isocyanates, potentially.
The welder with those intense sparks makes you think of burns and eye injuries, UV radiation too.
Absolutely. And fumes.
The foundry with the flowing molten metal is a clear thermal hazard, and aircraft refueling brings to mind the risks of flammable liquids and static electricity.
These images are a powerful reminder that hazard identification has to be specific to the tasks being performed and the environment in which they occur. The control measures needed for a painter in a spray booth, for instance,
Ventilation, RPE.
involving ventilation and respiratory protection, will be very different from those required for a foundry worker handling molten metal, where heat-resistant clothing and face shields are critical. It's not one size fits all.
Let's move on to another specific environment. A car battery disposal plant. This sounds like a place where you'd expect a significant number of potential hazards.
Oh, you're right. Car battery disposal plants are complex operations with a high potential for harm. Chemical exposure is a major concern, with sulfuric acid
Nasty stuff.
and lead being the primary components that can cause burns, respiratory problems, and long-term health issues due to lead absorption, especially neurological effects.
Lead poisoning, yeah.
The process of handling and dismantling batteries can also release flammable and toxic gases like hydrogen and sulfur dioxide. Lead contamination of the work environment is a serious risk, not only for workers, but potentially for the surrounding area if not properly managed.
This control is key there.
Absolutely. Fire and explosion are constant risks due to the presence of flammable materials like hydrogen gas and the potential for short circuits. Accidental spills and leaks of corrosive battery acid can cause immediate injury and environmental damage.
Slips and chemical burns.
Electrical hazards from the batteries themselves are also present, and improper disposal of battery waste can lead to significant environmental pollution. In this type of environment, a multi-layered approach to safety, incorporating engineering controls, safe work procedures, and appropriate personal protective equipment, is absolutely essential.
It's clear that different industries and even different jobs within those industries present very different safety challenges. Agriculture, for example, often has its own unique set of risks that might not be immediately obvious to those outside the sector.
Agriculture is indeed a unique and often underestimated sector in terms of workplace health and safety. Tragically, we see higher rates of lost time injuries and fatalities compared to many other industries.
Really? Higher rates?
Yes. These incidents often involve machinery like tractors, ATVs, and there are also risks associated with livestock handling and the environment itself, including hazards around dams, which can sadly affect family members and children on farms.
Oh, that's awful.
The high prevalence of self-employment can sometimes make consistent safety oversight more challenging, and factors like a remote nature of many farms and access to firearms can introduce additional considerations.
And when you actually break down the types of risks present in agriculture, it's quite a comprehensive list.
Absolutely. You have physical risks, such as prolonged exposure to strong sunlight,
Skin cancer risks.
electrical hazards from farm equipment and wiring, radiation from the sun, whole body vibration from machinery, thermal stress from working in extreme heat or cold, and noise from tractors and other equipment. Psychosocial risks like social isolation and stresses on family relationships can be significant in rural and remote farming communities. Then there's a wide range of biological hazards, including zoonotic diseases that can be transmitted from animals to humans.
Like Q fever.
Exactly. Anthrax or brucellosis and Q fever, as well as hypersensitivity reactions to things like dusts and molds, which can lead to conditions like farmer's lung, hypersensitivity pneumonitis.
Right.
Chemical risks are also prevalent, with exposure to pesticides like organophosphates and carbamates, fertilizers, fuels, solvents, and diesel particulates.
Lots of chemicals.
Design-related risks include injuries from manual handling of heavy items, falls from heights, and slips on uneven or wet surfaces. And finally, confined spaces like silos and manure pits pose dangers from oxygen depletion and the buildup of toxic gases.
Let's take a closer look at one of those biological hazards, Q fever. This seems like a particularly significant risk in livestock farming.
Q fever, caused by the bacterium Coxiella burnetii, is a significant occupational hazard for those working with livestock, Cattle, sheep, and goats are the primary reservoirs of this bacterium.
So it comes from the animals.
Primarily. And while they often don't show any signs of illness themselves, they can shed the bacteria in their milk, urine, feces, and particularly in high concentrations in birthing fluids and placental tissues.
During calving or lambing.
Exactly. What makes Coxiella burnetii particularly concerning is its resilience in the environment. It's resistant to heat, drying, and many common disinfectants, allowing it to persist in dust and soil for extended periods.
Wow, it's tough.
Very. This environmental persistence is why inhalation of contaminated dust is the main route of infection for humans. It's also highly infectious, with even a small number of organisms capable of causing illness.
And the symptoms of Q fever can be quite varied, it seems. Hard to pin down.
Indeed. Interestingly, a significant proportion of people infected with Coxiella burnetii don't recall having any noticeable illness. Asymptomatic. The incubation period can range from a few days to several weeks. When symptoms do occur, they can be quite flu-like, including a sudden high fever that can last for a week or two, intense muscle aches, fatigue, a dry cough, headache, confusion, nausea, vomiting, diarrhea, and sometimes abdominal or chest pain.
Sounds like a really bad flu.
It can be. Pneumonia can develop in a significant number of cases, and most people will have elevated liver enzymes indicating liver involvement. While acute Q fever is usually not fatal, a more serious chronic form can develop months or even years later.
Years later.
Often manifesting as endocarditis, an infection of the heart valves, particularly in individuals with pre-existing heart conditions or weakened immune systems. Chronic Q fever has a much higher mortality rate.
So accurate diagnosis is clearly important.
Diagnosis often involves blood tests to detect antibodies to Coxiella burnetii. There are two main types of antibodies measured, phase 1 and phase 2. In acute Q fever, the levels of phase 2 antibodies typically rise first and are higher than phase I antibodies. In chronic Q fever, this pattern is often reversed, with higher levels of phase I antibodies.
So the pattern tells you something.
It helps distinguish acute from chronic. Treatment for acute Q fever usually involves a course of antibiotics like doxycycline. Prevention strategies are multifaceted and include vaccination of livestock and at-risk workers where available.
There's a vaccine for people.
Yes, for Q fever there is. Also, proper disposal of animal birthing products, good hygiene practices when working with animals, pasteurization of milk and dairy products to kill the bacteria, and controlling dust in animal handling areas.
We also have brief mentions of other agricultural diseases like anthrax, leptospirosis, orf, brucellosis, psittacosis, and avian influenza. each caused by a different organism, transmitted in different ways, and presenting with its own set of symptoms. It really highlights the diverse range of health risks that agricultural workers face.
Absolutely. Each of these diseases poses a unique threat, underscoring the need for specific preventative measures, including animal health management, hygiene practices, and in some cases, personal protective equipment and vaccinations. For example, understanding the different routes of transmission, whether it's direct contact with infected animals, inhalation of spores, or contact with contaminated water, is crucial for implementing effective control strategies for each specific disease. You treat lepto very differently from anthrax, for instance.
Now let's change direction and talk about confined spaces. The regulations in NSW provide a very specific definition and outline the necessary precautions for working in these environments. They seem quite strict.
Yes, the work health and safety regulations in NSW define a confined space quite precisely. It's an enclosed or partially enclosed space that isn't primarily designed or intended to be occupied by a person.
So not an office.
No, it's at atmospheric pressure during normal operation, and because of its construction, location, contents, or the work carried out within it, may have one or more of the following characteristics. An unsafe oxygen level, a concentration of airborne contaminants that may cause injury, illness, or death.
Like toxic gases.
A concentration of flammable gas, vapor, or mist that may cause fire or explosion or may cause engulfment. Common examples include storage tanks, silos, pits, pipes, ducts, and even some underground areas.
And a critical factor for a safe working environment within a confined space is the level of oxygen in the atmosphere, what's considered safe.
That's correct. A safe oxygen level is defined as an oxygen concentration in the atmosphere of between 19.5% and 23.5% by volume under normal atmospheric pressure. Levels outside this range are considered hazardous and can have serious health consequences very quickly.
Below 19.5% is dangerous. Above 23.5% is also dangerous.
Yes. Too high an oxygen level increases the risk of fire significantly.
Right. The regulations place a strong emphasis on implementing specific risk control measures before anyone enters a confined space.
Absolutely. The fundamental principle is that no person should enter a confined space unless all reasonably practicable steps have been taken to ensure it is safe to enter and work in. This starts with trying to eliminate the need for entry altogether, if possible.
Can you do the work from outside?
Exactly. If entry is necessary, a system of work must be implemented that controls the risks. This includes ensuring a safe atmosphere through ventilation and testing, which means having a safe oxygen level, keeping airborne contaminants below the relevant exposure standards, controlling the temperature, and ensuring flammable substances are below 5% of their lower explosive limit, or LEL.
5% LEL. Okay.
A confined space entry permit system is mandatory, detailing the hazards, precautions, and emergency procedures. A dedicated standby person must be stationed outside the confined space while anyone is inside, equipped and ready to initiate rescue if needed.
They can't go in themselves, though, usually.
No, their role is to monitor and call for help, maybe initiate non-entry rescue. Emergency procedures and equipment, including rescue harnesses and retrieval systems, as well as first aid provisions, must be readily available. Measures must be in place to prevent unauthorized entry, such as signage and physical barriers.
Lockout, tech out sometimes?
Potentially, yes. Atmospheric testing and monitoring must be conducted before and, in some cases, continuously during entry. And, crucially, all workers involved in confined space entry must receive thorough and specific training on the hazards, control measures, and emergency procedures.
It's not just about the procedures for entry, though. The design of the confined space itself also plays a role in safety, doesn't it?
Yes, those who design, manufacture, and supply confined spaces also have responsibilities. They should, where reasonably practicable, design them to minimize the risks associated with entry, for example, by providing adequate access and egress points.
Making it easier to get in and out.
Ensuring that valves and gauges can be operated and read from outside the space. And minimizing internal complexities that could trap hazardous substances or hinder rescue.
When we think about the specific dangers within a confined space, what are the most significant risks? The things that can go wrong quickly.
The primary immediate risks are oxygen deficiency, which can lead to rapid unconsciousness and death. The presence of toxic gases, which can be released from materials stored in the space or generated by work activities like welding, and the risk of engulfment by liquids, powders, or granular materials.
Like falling into grain in a silo.
Precisely. Oxygen deficiency can occur due to processes like rust formation, decomposition of organic matter, or displacement by other gases like nitrogen or argon. Examples of dangerous gases commonly found in confined spaces include methane from decaying organic matter, carbon dioxide from fermentation or combustion, hydrogen sulfide, H2S, from sewage or manure,
Rotten egg smell.
sulfur dioxide from industrial processes, and carbon monoxide, CO, from incomplete combustion, like using petrol engines nearby. Engulfment hazards can arise from stored green in silos, flowing powders, or even the accidental release of liquids or steam into the confined space.
So a comprehensive risk assessment is absolutely vital before anyone enters a confined space. You can't skip that.
Exactly. Australian regulations require a detailed risk assessment to be conducted before any entry. This assessment must consider the specific nature of the confined space, the work to be performed, the methods to be used, all the potential hazards associated with both the space itself and the work activities, and the necessary emergency and rescue procedures. This includes carefully evaluating any equipment or materials that will be taken into the confined space to ensure they don't introduce new hazards.
Like solvents or welding gear.
Such as welding equipment consuming oxygen or generating fumes, or solvents displacing oxygen or being flammable.
And when it comes to rescue situations or high-risk entries where the atmosphere might be immediately dangerous to life or health, self-contained breathing apparatus, SCBA, is essential, right?
Absolutely. Tragically, a significant number of fatalities in confined space incidents involve people attempting rescue without proper equipment or training. Would-be rescuers becoming victims themselves.
Yeah, you hear about that.
Therefore, SCBA should always be used for any rescue attempts in a confined space where the atmosphere is or is suspected to be hazardous. It's also the appropriate respiratory protection for initial entry into high-risk confined spaces where the atmospheric hazards are known or likely to exceed safe limits. The critical message with confined spaces is that while they might seem innocuous most of the time, the potential for sudden and catastrophic events is very real if proper precautions are not rigorously followed. Complacency kills.
Let's move on to the topic of health surveillance. We have a scenario involving a geochemical analysis company looking to implement a health surveillance program for its employees. What are the fundamental principles behind health surveillance in the workplace? What's it trying to achieve?
Okay. The core principle of health surveillance is the systematic monitoring of workers' health over time to detect any adverse changes that might be related to their work environment or occupational exposures. It's a proactive approach aimed at early identification of work-related illnesses.
Catching things before they get serious.
Exactly. And monitoring the effectiveness of control measures. Are they actually working? It also provides data for ongoing risk assessments and helps fulfill legal obligations. Participation in health surveillance programs is typically regular and tailored to the specific hazards and risks associated with an individual's job role.
So how might this company apply these principles to its diverse workforce, including those involved in sample preparation, fire assay, laboratory work, and XRF analysis? They all sound like different roles.
They are. A comprehensive health surveillance program for this company would need to consider the specific potential exposures in each of these areas. In sample preparation, workers might be exposed to various mineral dusts, potentially including silica.
Dust again.
Fire assay processes often involve high temperatures and potential exposure to metal fumes, including lead.
Lead, okay.
Laboratory work could involve exposure to a wide range of chemical reagents and solvents, some of which might be sensitizers or irritants.
Skin or breathing issues.
And while typically well-controlled, XRF analysis could involve low-level radiation exposure, although usually minimal. Therefore, the program should be tailored to these specific risks. For instance, those in sample prep and fire assay might undergo regular respiratory health assessments, including questionnaires and spirometry, and potentially biological monitoring for specific metals like blood levels.
Checking what's actually getting into their bodies.
Right. Laboratory workers might have health checks focused on potential skin or respiratory sensitivities to chemicals, and those working with XRF equipment would likely have radiation exposure monitoring if required by regulations. Pre-employment health assessments are also important to establish a baseline for everyone.
We also have specific questions about the key components of health surveillance programs for noise, dust, and silica. What would those typically include? Let's start with noise.
Okay. For a noise health surveillance program, 4 main components are generally essential. First, baseline audiometric testing before an employee starts work in a noisy environment, or as early as possible.
A starting point.
Second, regular follow-up audiograms to monitor for any changes in hearing over time, comparing back to that baseline. Third, comprehensive training for workers on the risks of noise exposure and the correct use and maintenance of hearing protection devices.
So they know why and how.
And fourth, regular workplace noise assessments to identify high-risk areas and evaluate the effectiveness of noise control measures. You need to know if the controls are working.
Okay, and for a general dust health surveillance program?
For a general dust program, two key components would typically be regular respiratory questionnaires to identify any developing symptoms, such as cough, wheeze, or shortness of breath.
Asking the right questions.
And spirometry to objectively assess lung function and track any changes over time.
And for silica specifically, it sounds like that needs more.
Yes, for a silica-specific health surveillance program, a more comprehensive approach is usually required due to the severity of potential outcomes. This would include pre-employment and periodic respiratory questionnaires, spirometry testing, and depending on the level and duration of exposure, regular chest x-rays or even high-resolution CT scans, HRCT for better detail.
Imaging the lungs.
In some cases, particularly if there are symptoms suggestive of connective tissue disease, which can be linked to silica, monitoring for specific autoimmune markers in blood tests might also be considered. It's a more intensive level of monitoring.
Let's turn our attention to some of the practical tools used in workplace safety monitoring. We have an image here of a precision integrating sound level meter. What is this instrument used for, and what specific measurements can it provide?
This type of sound level meter is a crucial tool for measuring noise levels in the workplace, It can provide several key measurements, including the equivalent continuous sound level, LEC, which represents the average noise level over a measurement period.
Like the average noise loudness.
Essentially, yes.
Yeah.
As well as peak sound pressure levels for loud bangs or impacts, and it can calculate short-term exposure limits for impulsive noises. These measurements are essential for assessing workers' noise exposure and determining compliance with legal limits, like the 85 dBA standard.
What are some of the limitations or practical considerations when using a sound level meter like this in a real-world workplace? Are they tricky to use?
Well, while sound level meters are valuable, they do have some limitations. They can be more expensive than simpler sound level indicators. They can also be somewhat bulky to carry around for extended periods in dynamic work environments. The accuracy of the measurement depends heavily on how and where the meter is held.
Like pointing it the right way.
Exactly, and avoiding reflections. It provides a measurement at a specific point in space and time, which may not perfectly reflect an individual worker's actual noise exposure throughout their entire shift as they move around.
Right, just a snapshot.
And regular calibration is also essential to ensure the accuracy of the readings. You need to know the number is correct.
How would you go about designing a comprehensive noise monitoring strategy utilizing this type of sound level meter? Where would you measure?
A well-designed noise monitoring strategy would start by clearly defining the different work tasks performed and identifying those that are likely to generate significant noise. It's important to understand the typical duration of noise exposure for workers during a standard shift.
How long are they exposed?
Measurements should be taken both at the source of the noise-generating equipment, close up, and in the typical working positions of employees near their ears. Creating a sound map of the workplace, visually representing noise levels in different areas, can be very helpful.
Like a color-coded map.
Yeah, exactly. It helps identify high-risk zones and prioritize noise control efforts. Measurements should also be taken at different times and under varying operational conditions to get a representative picture of noise exposure, not just on a quiet day.
We also have mention of a personal noise dosimeter as another method for monitoring noise exposure. How does that differ, and what are some of the limitations associated with using a dosimeter?
A personal noise dosimeter is a small device worn by an individual worker, usually on their shoulder throughout their shift. It measures the noise levels right near their ear, so it can provide a more accurate assessment of their total personal noise exposure as it moves with them.
Gets their actual dose.
Yes. However, there are limitations. Worker compliance and wearing the dosimeter correctly for the entire duration of their shift is crucial, and this can sometimes be a challenge. People might forget it or knock it off. Proper training on how to use the device and ensuring it is calibrated correctly are also essential for reliable data. Additionally, day-to-day variations in work tasks and the specific environment can influence the measured exposure levels, so measurements over multiple days might be needed for a more representative assessment. One day might not be typical.
Where would someone look for authoritative guidance on how to develop and implement a robust noise monitoring plan in the workplace? Are there specific documents?
Yes. The Safe Work Australia Code of Practice on Managing Noise and Preventing Hearing Loss at Work is a key resource. And the Joint Australian-New Zealand Standard ASNZS 11269.1. Acoustics, Occupational Noise Management, and Measurement provide detailed and practical guidance on developing and implementing effective noise monitoring plans, including methodologies for measurement, data analysis, and reporting.
Okay, good resources there. If you conduct noise monitoring and find areas or workers with high levels of exposure, who would you typically consult with to implement remediation measures? And what kind of interventions might you consider? What's the process?
You would typically collaborate with engineers, particularly mechanical or acoustic engineers, as well as workplace health and safety specialists to address high noise levels. The approach would always be based on the hierarchy of controls.
Hierarchy again.
Always. The first and most effective step is to try and eliminate the noise source entirely or substitute it with a quieter process or equipment. Can you buy a quieter machine?
Right.
If that's not feasible, engineering controls are the next priority, such as enclosing noisy machinery, installing sound barriers or acoustic paneling, or using vibration dampening materials.
Physical changes to the workplace.
Administrative controls, like modifying work schedules to reduce exposure time or rotating workers through noisy areas, can also be implemented. As a last resort, if noise levels still exceed permissible limits after trying other controls, a comprehensive hearing conservation program would be necessary.
Which includes PPE.
Yes, including the provision of appropriately selected and fitted hearing protection devices like earmuffs or earplugs, baseline and regular audiometric testing, health surveillance, and ongoing training and education for workers on the risks of noise exposure and the proper use and care of their hearing protection.
We also have an audiogram here for a 45-year-old operator. Based on this, what can you tell us about their hearing? It looks like there's a dip.
Looking at this audiogram, there appears to be a pattern of hearing loss, particularly noticeable in the higher frequencies around 4,000 hertz, which is that characteristic dip or notch. This is a common indicator of noise-induced hearing loss, NIHL.
The classic NIHL pattern.
Yes. The configuration might also suggest a mixed hearing loss component, meaning there could be other factors involved as well. To get a clearer picture, it would be really important to compare this audiogram to any previous baseline audiograms for this individual to see if there has been any progressive deterioration in their hearing over time.
How does it compare to their first test?
Exactly. In the context of NSW workers' compensation for noise-induced hearing loss, several factors are considered. The extent of the hearing impairment as determined by audiometric testing, the individual's work history, and likely noise exposure in employment.
Did they work in noisy jobs?
And whether the hearing loss meets the criteria for a minimum level of permanent impairment, which is typically assessed as a percentage of whole person impairment. Non-work-related factors that could contribute to hearing loss, like age or certain medical conditions, are also taken into account.
We also have images of 3 other monitoring devices: an anemometer, a smoke tube, and a multi-gas meter. What are the primary uses of each of these tools in workplace safety? Let's start with the anemometer.
Okay, an anemometer is used to measure air velocity and calculate airflow rates. This is crucial for evaluating the effectiveness of ventilation systems, like in spray booths or labs.
Checking the airflow speed.
Ensuring adequate air changes in enclosed spaces, and assessing the performance of local exhaust ventilation used to control airborne contaminants like dust or fumes. Limitations can include the need for careful placement to get accurate readings, especially in complex ductwork, and potential inaccuracies in turbulent airflow.
Okay, and the smoke tube looks simple.
It is. A smoke tube is a simple, low-cost device used for visualizing airflow patterns. You break off the ends, squeeze a bulb, and it releases a puff of harmless smoke, and you can then observe the direction and speed of the air movement.
See where the air is going.
Exactly. It's very useful for qualitative assessments of ventilation, like checking if a fume hood is drawing air correctly, or identifying drafts or dead spots with poor airflow. Advantages include its low cost, portability, and the fact that it doesn't require a power source. However, it only provides a qualitative assessment.
Yep.
You can't get a number from it. It's typically single use, and the interpretation of the smoke plume relies on the user's observation and experience.
Right, subjective. And the multi-gas meter. Looks more complex.
It is. A multi-gas meter is a more sophisticated instrument equipped with various electrochemical or other types of sensors that can simultaneously monitor the levels of multiple atmospheric gases.
Which gases usually?
Typically oxygen, carbon monoxide, CO, hydrogen sulfide, H2S, and flammable gases, often measured as LEL. Its primary uses are for assessing the safety of confined spaces before entry.
Essential for that.
Monitoring for leaks of hazardous gases in industrial settings, and ensuring adequate oxygen levels in potentially hazardous atmospheres. Advantages include the ability to monitor multiple hazards at once, built-in audible and visual alarms to warn of unsafe conditions, and often data logging capabilities to record measurements over time.
Okay, and the downsides?
Disadvantages include the need for regular calibration and bump testing to ensure sensor accuracy that's critical. Also, the limited lifespan of some sensors, which need replacing periodically, and the higher initial cost compared to simpler devices. In the photograph provided, the multi-gas meter is most likely being used to check the atmospheric conditions inside or near a confined space before entry is permitted. Standard procedure.
Let's move on to the interpretation of respiratory function tests, or spirometry. We have a spirometry graph here that shows a distinct coving or concave shape on the expiratory limb, along with a reduced peak expiratory flow, PEF. What does this pattern typically suggest?
The coving on the expiratory flow volume loop, that scooped-out appearance, is a classic indicator of airflow obstruction. It means there's difficulty in getting air out of the lungs quickly, especially at lower lung volumes.
Harder to push the air out.
Yes. The reduced peak expiratory flow, PEF, which represents the maximum speed at which someone can forcefully exhale right at the beginning, further supports the presence of airflow limitation. This pattern is commonly seen in obstructive lung diseases like asthma or COPD, chronic obstructive pulmonary disease.
We also have some spirometry data showing an FEV1-FVC ratio that is below the lower limit of normal, but a forced vital capacity, FVC, that is within the normal range. Additionally, there's no significant improvement in either FEV1 or FVC after the administration of a bronchodilator.
Yeah.
How would you interpret these findings?
Okay, this pattern, a reduced FEV1-FVC ratio with a normal FVC, is characteristic of an obstructive lung function impairment. The FEV1-FVC ratio is the percentage of the total lung capacity, FVC, that can be exhaled in the first second at FEV1, and a reduced value indicates that airflow is obstructed.
So definitely obstruction.
Yes. The fact that there's no significant improvement in FEV1 or FVC after the use of a bronchodilator, which is a medication designed to open up the airways,
Like Ventolin.
suggests that the obstruction is likely not readily reversible, or at least not fully reversible at that time. This is a typical finding in conditions like COPD, which involves more permanent airway changes, or in some cases of chronic, poorly controlled asthma where there may be fixed airway narrowing or remodeling.
Finally, we have a chest X-ray of an underground miner who presented with restrictive spirometry, so difficulty getting air in this time, and the X-ray shows bilateral diffuse reticulonodular opacities. That sounds like a kind of fine, widespread nodular pattern throughout both lungs. What would be your initial thoughts on the possible causes, especially given the job?
In an underground miner with restrictive spirometry and this characteristic pattern on a chest X-ray, pneumoconiosis, specifically either coworkers pneumoconiosis, CWP, or silicosis, would be a primary consideration given their likely occupational exposure to dusts. That's top of the list.
Makes sense.
However, other conditions can present with similar findings, so you need a differential diagnosis. This would also need to include idiopathic pulmonary fibrosis, IPF, which is scarring of unknown cause, sarcoidosis, an inflammatory condition, hypersensitivity pneumonitis, HP, and inflammatory lung disease caused by inhaling certain organic dusts or chemicals.
Like farmer's lung again?
Tuberculosis, TB, which can sometimes present diffusely, metastatic disease, cancer that has spread to the lungs from elsewhere, and interstitial lung disease, ILD, associated with connective tissue disorders like rheumatoid arthritis or scleroderma. The bilateral diffuse reticulonodular pattern is a common radiological finding in many different types of interstitial lung diseases. It tells you something's wrong diffusely, but not exactly what.
Interestingly, this miner also reported symptoms like fatigue, weight loss, joint pain, arthralgia, shortness of breath, dyspnea, and a dry cough, which eventually led to a diagnosis of sarcoidosis. So not directly the dust in this case. Beyond the lungs, what are some of the other ways that sarcoidosis can affect the body? It sounds systemic.
It is. Sarcoidosis is a systemic inflammatory disease characterized by the formation of granulomas, tiny clumps of inflammatory cells that can affect virtually any organ in the body. While it most commonly involves the lungs and the lymphatic system, causing enlarged lymph nodes often seen on chest x-ray,
Right.
it can also affect the cardiovascular system, leading to arrhythmias or cardiomyopathy, the skin with various rashes or nodules like erythema nodosum, the eyes causing uveitis and inflammation of the middle layer of the eye, which can affect vision, the musculoskeletal system, resulting in joint pain, muscle weakness, or bone cysts.
Joint pain was mentioned.
The nervous system, leading to neurosarcoidosis with a wide range of neurological symptoms like facial palsy. The endocrine system, potentially causing high blood calcium levels or affecting the pituitary or thyroid glands. The liver and spleen, leading to enlargement and dysfunction. The kidneys, potentially causing kidney stones or interstitial nephritis, and even the bone marrow, affecting blood cell production. The range of potential symptoms can make diagnosis quite challenging sometimes.
Given that this miner was diagnosed with sarcoidosis, how would you approach the complex issue of determining their fitness for duty to continue working as an underground miner? That seems tricky.
Assessing fitness for duty in this situation would require a comprehensive and multidisciplinary approach, definitely. It would start with a thorough medical evaluation by a physician experienced in respiratory and occupational medicine, assessing the current severity of their sarcoidosis, the extent of lung involvement and any other organ involvement like heart or eyes, and their current symptoms and functional limitations.
How bad is it right now?
Detailed lung function tests, including spirometry, gas transfer, DLCO, and possibly a 6-minute walk test would be necessary. A careful analysis of their specific job tasks and the physical and environmental demands of working underground is crucial.
What does the job actually involve?
To understand the potential risks of exacerbating their condition or compromising their safety or the safety of others. A functional capacity evaluation, FCE, might be helpful to objectively assess their physical abilities to perform essential job functions like lifting, climbing, or working in confined spaces.
Testing their actual abilities.
We would also need to explore potential workplace accommodations that might allow them to continue working safely, perhaps in a different role, or with modifications to their tasks or work environment. Regular monitoring of their condition and lung function by their treating specialist would be essential if they were to continue working.
Close follow-up.
Ultimately, the decision would likely involve consultation between the occupational physician, the treating respiratory physician specializing in interstitial lung diseases, the employer, and the worker. And it would need to take into account relevant legislation regarding fitness for duty in the mining industry in Australia, which is typically governed by Work Health and Safety Acts and specific mining safety regulations that place duties on both employers, PCBUs, and workers.
Finally, let's consider a critical emergency response scenario. An unconscious excavator operator and a vomiting spotter found near a mine workshop. What would be the immediate steps in responding to this situation? Chaos, initially, I imagine.
The immediate response must prioritize the safety of the responders and the well-being of the affected workers, even amidst chaos. The first steps followed DRS ABCD, check for danger, is the area safe, gas fumes, check for response, send for help immediately, call emergency services and the site emergency response team.
Get help coming.
Check airway, check breathing, start CPR if needed, apply defibrillation if available and required. Emergency services, including an ambulance, should be called immediately, clearly stating the situation, number of casualties, and location.
Clear communication.
If there's any suspicion of chemical exposure, approach with extreme caution and ensure appropriate personal protective equipment, PPE, is used by all responders. Could be respiratory protection, gloves, suits, depending on the suspected agent. Move the individuals to a safe upwind area or the mine's medical center as soon as it's safe to do so.
Get them out of the hot zone.
Clinic staff should also don appropriate PPE and prepare for potentially contaminated patients, considering isolation or quarantine protocols if a hazardous substance is suspected. Obtain vital signs, pulse, breathing rate, blood pressure, oxygen saturation, for both individuals and start continuous monitoring. If possible, try to get a brief history from the spotter if they are conscious and able to communicate what happened, what were they doing, what did they see, smell, or feel before becoming ill.
Any clues at all?
Simultaneously, deploy a member of staff to immediately locate and retrieve the safety data sheets, SDS, for any chemicals stored or used in the vicinity of the mine workshop. Establish intravenous access if trained personnel are available and it's indicated.
Speaking of SDS, which used to be called MSDS, what are the critical pieces of information you'd be looking for on one in this kind of emergency? Where do you look first?
In an emergency situation like this, you need key information fast. The most critical sections of the SDS are usually Section 1, which identifies the substance and the supplier, including emergency contact phone numbers.
Who to call.
Section 2, which outlines the hazards of the chemical, including acute health effects like immediate breathing problems, skin burns, effects on consciousness, and routes of exposure. Section 4, which details first aid, measures what to do immediately for inhalation, skin contact, ingestion, eye contact.
So what to do section?
Section 5, firefighting measures, relevant if there's a fire risk. Section 6, accidental release measures, including containment and cleanup, which might be relevant to the responder's safety. Section 8, which specifies exposure controls and personal protection equipment, PPE, that should be used when handling the chemical vital for responders and medical staff. And Section 11, which gives detailed toxicological information like target organs and specific symptoms, though that might be for later review. Quickly reviewing Sections 2, 4, and 8 will provide vital clues about the potential cause and guide the initial management.
How would you go about trying to determine the likely effects of a chemical exposure in this scenario, especially with one worker unconscious and the other vomiting? What are you looking for?
Determining the likely effects involves a combination of clinical assessment, information gathering, and using resources like the SDS. A thorough clinical examination of both workers is crucial, looking for patterns of signs and symptoms that might suggest a particular type of chemical exposure or toxidrome. A toxidrome is a recognizable syndrome, a cluster of signs and symptoms caused by certain classes of toxins. For example, organophosphate poisoning has a characteristic toxidrome. This assessment would include their level of consciousness, pupillary responses, pinpoints, breathing patterns, heart rate, blood pressure, skin appearance, but shallow, and any specific odors on their breath or clothes.
Checking all the vitals and signs.
If the unconscious worker regains consciousness, obtaining a detailed history of what happened is vital. Reviewing the SDS for any chemicals found near the workshop is essential to understand their known health effects, symptoms of overexposure, and potential routes of exposure.
Matching symptoms to the SDS.
If possible and relevant, initial pathology tests, such as blood gas analysis, checking oxygen, CO2, acidity, and basic metabolic panels, checking electrolytes, kidney function, might provide clues about the physiological impact of the exposure. And importantly, consulting with a medical toxicologist or a Poisons Information Center, like Poisons Information Center in Australia, can provide valuable expert guidance based on the clinical presentation and any identified chemicals.
And what would be the general approach to managing this kind of chemical exposure incident at the Mine Site Medical Center before the patients are transferred to a hospital, assuming they need transfer?
The general management would focus on several key areas, remembering the ABCs, airway, breathing, circulation, are paramount. First, immediate stabilization of the patients, including ensuring a clear airway, intubation if necessary, providing supplemental oxygen or assisted ventilation for adequate breathing, supporting circulation with IV fluids or medications if needed, and treating any immediate life-threatening conditions like seizures or arrhythmias.
Keep them alive first.
Decontamination is a critical early step if there's any chemical on their skin or clothing to prevent further absorption by the patient or exposure to responders. This would typically involve carefully removing contaminated clothing, cutting it off if necessary, and irrigating exposed skin and eyes with copious amounts of water or saline.
Wash it off.
Supportive care tailored to the patient's symptoms is essential, managing vomiting with antiemetics, providing pain relief, managing agitation, maintaining body temperature. If the specific chemical is identified and a specific antidote is available and indicated, like naloxone for opioids or atropine for organophosphates, it should be administered as per medical protocols and expert advice.
Antidotes if available.
Close and continuous monitoring of vital signs, oxygen saturation, cardiac rhythm, and neurological status is crucial. And finally, clear and detailed communication and handover to the receiving hospital paramedics and emergency department is vital for ensuring continuity of care and appropriate ongoing management. This includes details of the incident, suspected chemicals, clinical findings, treatments given, and SDS information.
Finally, what kind of legislation related to workplace health and safety might be particularly relevant in responding to this kind of emergency scenario at a mine? What laws apply?
In this type of emergency at a mine in Australia, several pieces of legislation would likely be relevant. The primary one would be the Work Health and Safety, WHS Act, and its associated WHS regulations in the relevant state or territory. These place general duties on the person conducting the business or undertaking, PCBU, the employer, to ensure the health and safety of workers and others,
The main safety law.
and include specific duties related to managing risks from hazardous chemicals, providing information like SDSs, training, ensuring safe use and storage, and planning for emergencies. Given that it's a mine, specific mining safety legislation and regulations, like a Mine Safety and Inspection Act or similar, would also apply. These often contain more detailed requirements specific to the mining industry,
Mining-specific rules.
covering things like emergency preparedness, incident notification and investigation requirements, ventilation standards, and the management of specific hazards commonly found in mining environments, potentially including requirements for emergency response plans, trained personnel, like Mines Rescue, and having appropriate emergency equipment readily available. Public health legislation might also be relevant depending on the substance and potential community impact.
We have covered a vast amount of crucial information today, from the selection of the right respiratory protection to the intricacies of confined space entry and the critical steps in an emergency response. What are some of the overarching key takeaways from this deep dive into workplace safety materials?
I think the most fundamental takeaways are, firstly, the critical importance of proactive hazard identification and risk assessment in all workplaces. You have to look for the problems before they cause harm.
Be proactive.
Secondly, the necessity of implementing control measures based on the hierarchy of controls, always striving to eliminate or substitute hazards first before relying on lower-level controls like PPE.
The hierarchy is key.
Thirdly, the incredible diversity of potential workplace exposures across different industries. We saw bakeries, mines, farms, battery plants, each requiring tailored and specific safety management systems. It's not generic. Furthermore, regular health surveillance plays a vital role in the early detection and prevention of work-related illnesses, acting as a safety net. And finally, being thoroughly prepared for emergencies, including having accessible information like safety data sheets and well-rehearsed procedures, can significantly improve outcomes when the unexpected inevitably happens. Preparation matters.
Consider the weight of what we've discussed. Whether you're an employee, an employer, or simply someone interested in understanding the world around you, recognizing these potential risks and the systematic approaches to managing them is paramount for creating and maintaining safer working environments for everyone. It's not just about compliance, is it?
No, it's about people's health and lives.
The level of detail in these sources highlights that being truly well-informed goes beyond just understanding the broad concepts. It involves grasping the specifics, from knowing why one type of respirator is appropriate in a certain situation and another absolutely isn't, to recognizing the subtle early signs of a serious health condition related to workplace exposure. The details really matter.
This deep dive is really just scratching the surface of a vast and vital field. We encourage you, the listener, to reflect on the environments you encounter, whether at work or elsewhere, and perhaps even explore in more detail the specific areas we've touched on that particularly resonated with you.
Yeah, what piqued your interest?
What other workplace hazards are you now more curious about? What further questions do you have about the role of health surveillance or the complexities of emergency response? There's always more to learn.
Ultimately, the safety and well-being of individuals in the workplace are not static goals, but rather an ongoing process of continuous learning, diligent assessment, and proactive management. By gaining a deeper understanding of the potential depths of risk that can exist in various work environments, we can all contribute to fostering healthier and safer conditions for everyone.